The inventor of the polio vaccine, I know, refused to patent it. The distribution was privately funded. The flu vaccine is an open source with global collaboration. You would think that this wouldn't be patented and held by the United States government. As of April, our government has paid Moderna $6 billion to support the vaccine that they co-own. So if we own 50% of it, are we getting paid? Are we getting a discount? Where's that money going to? And if we're not getting money, why the hell would we have this agreement? Now, keep in mind that Moderna is a company that attempted to bring 9 previous products to market, including with this mRNA technology. All were unsuccessful, all 9 times. The most recent actually occurred right before COVID. Only once was Moderna even able to develop a product that advanced to human trials portion of development. So this is their first success. Or is it? I mean, how many more unlimited booster shots are we going to have to take? I mean, in the next 10 years. And this might be the biggest conflict of interest case in all of mankind. Now, okay, I thought, well, maybe the government's smart, maybe they're getting money, but why wouldn't they tell you this? What does the government gain here? Well, you don't need to look further than the Great Reset and their goal of public-private partnerships on a massive scale. They are now working in partnership with private pharmaceutical companies. All these politicians, we don't like those big pharma. They're in bed with them. They share ownership of intellectual property. They are now beholden to the federal government's whims and regulations. If they jump, the only answer is how high. This is the precedent they are moving towards for all of society, not just in America, but the entire Western world. We're seeing it now in industries across the spectrum. The biggest and most frightening right now is banking and big tech. It's the standard everywhere. Do you remember when we thought it was a little odd that the government shut down the Johnson & Johnson vaccine? It was really nothing to worry about. In fact, the others had the same kind of flaws. And when they shut this down, when they shut down Johnson & Johnson, everything went off the rails. People stopped taking the medicine. That's when we started saying, well, we have to have a mandate. It never made sense to me. Maybe it makes a little more sense now. Johnson & Johnson vaccine isn't mRNA.